Welcome to fractureinfo.co.uk. My name is Neil Kang, consultant trauma and orthopaedic surgeon who works at Addenbrooke's Hospital.
And my name is Abbas C., a medical student at the University of Cambridge.
Following an injury to your shoulder or clavicle, you may have been prescribed exercises called pendulum exercises to help mobilize your shoulder and prevent stiffness within the first few weeks. This will have been determined by the clinician that you have seen either in the emergency department or the fracture clinic, and they will tell you the best time to start these. Abbas will demonstrate to you how to perform these pendular exercises. The first exercise is to lean, supporting your body weight on a firm object, and then to move your injured shoulder and arm from side to side across the front of your body. The second exercise is to move the injured shoulder forwards and backwards next to your body, as demonstrated by Abbas. The final set of pendulum exercises are to describe small and large shaped circles using your finger. We hope that you have found this video useful, and please do look at any other videos related to your injury. If you have found the service useful, please do leave your feedback at fractureinfo.co.uk.